know about those. If we could advance the slides, please. So for those of you not familiar with these traces, I've been building these for 600 plus days with my team to inform the community of what's going on. What you see is on the horizontal axis is time, and basically, quantity or amount on the vertical axis. In this case, the graph is about positive cases. So what we have, I'm getting comments in the bottom section there. What we have on this plot is the positive cases for our region over time. So you see the Delta variant there from say late July to now. And then all of a sudden you see the prediction we have for Omicron in that gray envelope where things get a little more complex to look at. If it turns into an eye chart for you, just look at the inset where you can see I've tried to blow that up so you can see what we really have going on. That's how we know that Omicron is in the region. We were following the Delta trace. Prior to that little black squiggly line was following the Delta trace, and then we deviated into that magenta trace. The magenta is Omicron. That's the pathway that we think Omicron will take through the region. We have an upper boundary on that. We certainly hope we don't get near the upper boundary. We have a most likely track, which is that magenta, and then we have the blue, which is our better case track, and that's the one we're hoping for. But right now we're on the magenta, the predicted value, and we expect to see nearly 2,000 cases per day in the region by January 17th. That's a very large number. Those are just really record numbers for our region. Back when you don't see on this trace, you don't see the original surge. We were in the 700 to 800 case per day level back then. Now we're looking at 2,000. So it's a different kind of virus, very transmissible, maybe not as dangerous, but still with those kind of volumes, it causes a lot of impact on our system and on our community. Let's advance the slide. Thank you. So with the first graph being positive cases, I know a lot of you are concerned about how many of those turn into hospitalizations. This is a plot, same kind of layout, time on the horizontal axis, and then severity or a number count on the vertical axis. You see Delta, you see what Delta has done since late July. And now you see the very beginnings. Again, I've blown it up inside the red ellipse. I've blown that up and made a little inset there to the right where you can see what's going on with Omicron. Omicron has now broken from the trace that was Delta, and we know that Omicron is in the region. And now we're on that expected track again, the magenta, the middle track through that probability envelope there that I basically call that, and that gray region. And so we're at 136 cases right now. Again, a very large number, moving into about a 160 level, 150 to 160 in the next 2 to 3 weeks. The deal with these hospitalizations is their length of stay will be much shorter, and they'll put different kind of pressures on the system. So if we can move to the next slide, please. Oh, apparently a slide was removed. So I'll just speak to my points here on this one. The important thing to notice about Omicron, and I believe others will be speaking about this today, is that Omicron has a shorter length of stay. It will affect far more people in the region. Up to 50% of the people in our region could end up getting Omicron if the predictions hold true. And it won't hospitalize as many in terms of percentage, but sheer numbers, it's going to bring a lot of sheer numbers to our clinics, a lot of numbers to our EDs, places that could become overrun. And I know others are going to speak about that and help us know what to do to manage where those folks need to go. So Omicron's different. And I move it on to Lynn to give you further updates.
All right, if we could go to the next. Thank you, Cassandra. Hi, I'm Lynn Detterman from ThedaCare. So just wanted to cover a few things for all of you today. So last week, we saw that the Wisconsin Department of Health reported the highest one-day increase of COVID cases in the state, which was more than 12,000 people at that time. I think we're going to quickly see this week that will likely surpass those numbers. And we also reached a grim milestone. 1 million people have tested positive at least once for COVID during this pandemic in our state. So what does that mean, and how does that break down into, what's going on as far as the hospitals are concerned? That means that 1 in every 100 cases are fatal, and that 1 in 20 cases result in hospitalization. So right now, and you probably have heard this from your friends and family that maybe work in healthcare, our hospitals are full and our wait times are long. This is coupled with the challenge that we have with labor shortage across the country, and healthcare is probably even more prevalent in that labor shortage because people have been leaving healthcare over the last 2 years. COVID has really weighed on people, and they've decided to retire early or even choose different careers. And so that challenge, in addition to the demand on services, is really creating these issues for us. And so on any given day, I'm sure all 3 health systems that are here today can talk about the number of patients that they're boarding in the emergency departments, which means patients are waiting for a bed. There's not a bed available in that facility, and there aren't beds available to transfer patients. And so they're just waiting for beds to open up on the units of those respective facilities. And it can really create a lot of bottlenecks in our emergency departments. I'll use one of our critical access hospitals as an example. They have 12 exam rooms in their emergency department. 10 of them were taken by boarders last week on a couple of days, which just creates our inability to move the other patients through on a timely basis. The majority of patients that are in our ICU, so the ICU is where our sickest patients are, they are unvaccinated, by and large, the majority. This is the worst we've seen in this pandemic, and it's the worst, this surge is the worst that we've also seen. So as health systems, we're going to continue to partner. We monitor daily patient levels and make needed adjustments. There's a patient that needed help from Aurora, Oshkosh this weekend that we transferred up here because we had a bed. And it was probably a brief moment in time that we had that bed, but it worked out for that patient. So we are all partnering in as many ways possible to make sure that we care for our communities that we serve. And we've been studying modeling and trends. And so Frank from ThedaCare, he's getting really good, unfortunately, at this modeling. And the numbers that he is showing have just been, over the last few weeks, been tracking on that magenta line. And so we've been bracing ourselves and trying to prepare as much as possible over the last few weeks to be ready for this. And it will increase sharply. So he talked about by the 17th, the numbers that we would see, and that will overwhelm the system as we continue to climb up that magenta curve. The good news is, the hope that it gives all of us is that we will see this decline also quickly. So this is a short-lived surge, and we cannot wait for that to happen, but we need your help now. So our hospitals in the region must be there to care for COVID patients, but this also creates access issues for our patients suffering from heart attack, stroke, serving those who need cancer treatments, even wellness visits. Obviously those have to be delayed. And our goal is to always keep patients as close to home as possible. It's heartbreaking when we have to transfer a patient out of the area. I think it was Saturday, we were looking for an ICU bed for one of our critical access hospital patients, and there weren't any in the state that we could find. And we get calls from out of state all the time of hospitals looking for beds. And this is the reality of our situation right now. So to discuss getting the right care in the right place, I'd now like to bring in Dr. Tom Nichols, Regional Chief Medical Officer and a pediatric hospitalist for Ascension, Wisconsin, in the Fox Valley.
Thanks, Lynn. I always enjoy is probably not the right word. I always appreciate seeing Frank's projections and interpretation of the data. So I appreciate seeing that. Thank you, Frank and Lynn. So what I would say is that I would echo Lynn's statements about us being strained in our ability to meet the healthcare needs of the community. At Ascension, like every other health facility, that's our mission, is to meet whatever healthcare needs exist in the community as well as we can on a daily basis. But that's been more challenging recently with the rising number of cases we are seeing, and also the rising number of staff who are out sick with illness. So what can the public do? I would say there's two things. One is if you're sick, stay home. Most of the tests that we're doing on patients that are seeking COVID tests are coming back positive. So please, if you are feeling symptomatic, stay home. If you're not feeling symptomatic, continue to wear a mask, continue to social distance, because this strain of virus is incredibly contagious. When we talked about the R naught, which is a figure that we talked about early on in the course of the pandemic, the R naught for the original strains and the Delta strains were somewhere from 1 to 2. That means for every one person that's infected, they would infect another 1 to 2 people. For this strain, we're seeing estimates that the R naught might be as high as 10, which means that for every one person infected, they may infect as many as 10 other people. And so that's what's causing this explosion in cases in our community. The second thing the public can do is just make sure that they're seeking care from the right place at the right time. So the emergency room is still the right place if you have a medical emergency, if you're having trouble breathing, if you have a broken bone, if you're having chest pain or neurologic symptoms, the emergency room is still the safest place for you. But as Lynn mentioned, when we start to fill up our hospitals and have no beds available, those patients continue to need care and are seeing that care in our emergency room. And so their wait times in the emergency room are getting longer while they're waiting for a bed. That's putting a lot of strain on our emergency room's ability to meet all the healthcare needs. So if you have mild symptoms, if you're just looking for a COVID test, please don't go to the emergency room for that. We have primary care physicians, we have urgent care clinics, and we have pharmacies like CVS and Walgreens that have testing resources throughout the Fox Valley. So for those mild symptoms, for those testing needs, please choose the appropriate site of care. I think next we have Dr. Temple from Aurora, who's going to talk about vaccination. Thank you.
Sorry about that. I was trying to find my mic. Thanks, Dr. Nichols. Well, we do appreciate everyone joining us here today. As stated, my name is Dr. Brian Temple. I'm an infectious disease physician at Aurora Medical Center in Oshkosh. This morning, I would just like to discuss boosters and vaccination. As you may have heard, the situations at our area hospitals, they just continue to grow more challenging each day. The wait times are long and team members are strained. Regardless, we continue to be here for the public throughout the pandemic. We're asking for your help in stopping the spread of COVID-19 virus and the Omicron variant. As we already know, this has become the most dominant strain nationwide and in our area. So we do have a tool that has been proven to help as we keep hammering on, and that is vaccination. So as a physician, to be honest, it's really not easy seeing patients in the hospital who are struggling, some of them extremely ill, on ventilators, and some just needing just extra support with oxygen. We see patients admitted talking. A few hours later, they're fighting to breathe. We're seeing younger patients who would not consider themselves to be at risk, and they're fighting to breathe. Some of them just fighting just to sit up to talk to you. And they need help to use the bathroom as they can't get oxygen, as we keep saying. They also have had patients who are trying to make the decision whether to breathe or to eat. And again, that's a reality that we do see. We've seen increase in death in this group of patients. None of us can get used to seeing family members just standing outside the windows as their family members are fighting to breathe, and some of them are dying. So again, with all of this, is really what we're asking is just please, please, please get vaccinated and boosted. Our COVID inpatient census continues to rise, as the rest of the team have already stated. 90% of the COVID patients hospitalized are unvaccinated, hence the reason why we keep trying to push for vaccination. We know the best way to avoid hospitalization again and severe disease is vaccination. And as it becomes clear that the booster shot does add significant protection, again, those who have been vaccinated and who are up for their booster, please go ahead and get it. And we're seeing that the booster does help even with the Omicron variant. According to CDC, the emergence of the Omicron further emphasizes the importance of vaccination, boosters, and prevention efforts needed to protect against COVID-19 virus. As we know, early data suggests increased transmissibility to the Omicron variant and the potential of immune evasion. So I'm urging everyone to please, again, not to be the dead horse, get vaccinated and get a booster if you're eligible. So just kind of an update on the CDC recommendation regarding boosters, etc. So now the CDC does recommend that those ages 12 to 17 should get a booster 5 months after the initial Pfizer biotech vaccination series. Adults 18 and older who receive Pfizer or Moderna, those they can receive any of the COVID vaccines at least 6 months after completing their primary booster vaccine series. And adults 18 and older who receive Johnson & Johnson vaccine, those people, that group can receive boosters at least 2 months after their first shot, sorry. So again, just to rehash, please remember, COVID-19 virus is not the only respiratory virus we're dealing with during this period. We are dealing with various cold and flu viruses, which have added to the hospital burden. Flu vaccines are available for those eligible. Please go ahead and get vaccinated. Also, please remember the other public health measures like wearing masks and avoiding large gatherings. And they ask, should you wear a mask inside? I say, yes, I do. Masks help prevent the spread of the virus, especially indoors, especially when we're looking at an R0 of talking about 10. That's a highly contagious virus. Outside, what do we know? We know spread is less likely, but we still recommend, yeah, if you can wear a mask, go ahead. And yes, it's kind of cold as you see outside today. It might keep your face a little warm. So again, please stay home if you test positive for COVID-19. As well work to keep from infecting each other. Remember, we're all in this together. And I just want to say thank you for your time. Now I'd like to introduce Doug Yen, a Winnebago County Health Officer. Thank you.
Thank you. Thank you, Dr. Temple. Good morning. Just want to talk a little bit about testing. Testing, we know, is a very critical component to helping limit the spread of COVID. It's really important to know if you're positive and if you're a risk to others, especially those within your household that you have the most contact with. That being said, we know that testing may become a limited resource due to the demand. The high numbers of cases are pushing more and more people to get tests, and there may be a point where testing is going to be much more difficult and time consuming to get. What's good to know, though, is that, if you have been exposed to someone or you have really mild symptoms, you have other options other than going to a testing site. If you have just been exposed, you'd like to know if you're positive, you want to know if you should quarantine or isolate, you can just stay home. If you have the ability to stay home, please do. You can get a test kit sent to you directly from the DHS website. I ordered one. It came in about a day, and you can test at home and then have a test result in just a few days. If your need is more urgent and you need to make a decision, certainly seek out one of the testing sites. You can see on the slide here there are a number of websites for testing options. In addition to DHS and the regional testing site, calling 211. Contacting your local health department. They're probably going to have the most up-to-date list if there's any changes on testing sites. And it's really important that if you feel like you need a test, you need to stay home and wait for the results. If you need a test, it's because you've been exposed or you're having symptoms. And really the best thing to do is to stay home at that point in time. This has been a difficult situation for all of us, and we can all do our part to help slow the impact of this disease. Right now, we're really working hard to not overwhelm our healthcare systems, and really everyone has the opportunity to participate in that. And we can all do that by making sure that we stay home, that we're sick when we're sick, that we take a look out for those in our household, help them stay home, help our neighbors stay home. Work with your employer. They don't want you at work if you're feeling ill. So please, especially if you're feeling ill, stay home. Getting vaccinated and boosted is going to be the ultimate thing that everyone can do to help us get through the pandemic. In the meantime, wear a well-fitting mask. Again, stay home if you're sick. Use testing to help you make good decisions, especially if you have symptoms. And as Tom shared, seeking the right care in the right place. If you have severe symptoms, you do need to be seen, and you should go and contact your healthcare provider right away. It's not too late to vaccinate. Even every dose, even the first dose, starts protecting you from more severe illness. We're in this for the long haul, so it's not too late to start. I really want to thank all of our community partners. This has been quite the journey so far. And hospitals, healthcare systems, elected officials, businesses, all of our community partners are working together right now to help us get us through this difficult time. And we will. We need to be a little patient. It's okay to slow down and take a break. Do that for yourself, do that for the community, do that for our hospital systems, and we'll get through this together. Sandra?
Thank you, Doug. Appreciate all of our spokespeople giving those brief comments. I do have some questions coming in from media through our chat, so we will begin to address those. I'm just going to go down the line and call on the outlet or specific reporter that I see. So again, if you have a specific question, please send me a message in the chat and I will just call on you from there. Let's go ahead and start with Paul from WFRV. Paul, your question? Paul, did you have a question? Okay, so we will move on to the next. Rachel from NBC 26, your question.
Thanks, Cassandra. I think this would also be good for Dr. Temple, but obviously would love anybody's input. How do you guys expect the booster approval for kids 12 to 15 years old to impact the current curves?
Hi. So as adults, I don't deal with kids much, but as you know, whenever we do have vaccination available for children, that definitely should decrease as far as the overall transmission of the disease, because the less people that we have at risk, the less likely we are to transmit the disease.
I would just add that I'm a pediatrician by training, and just about every age group, the risk of that person developing significant illness from COVID far outweighs the risk of vaccination. So the push for vaccination and the approval in that age group is because the vaccine is effective and safe in preventing serious illness. So I don't know how much it's going to impact the disease curves in the area, but it is protective for kids that age. And over time, I think that the protection will increase, particularly if we have variants who are more significant in their impact on children.
Thank you for that addition, Dr. Nichols. We appreciate it. We're going to go back to Paul's question. He has a bit of issue with the microphone, so we're going to ask it for him. Paul is asking, should people be reporting their results, the positive results from home rapid test kits, and how do they go about doing that? Why is it important? Doug, that's probably a good question if you could take that. So should people be reporting at home positive results? How do they do that, and why is it important?
Thanks, Cassandra. Yes, if you have a positive test result at home, there's a number of things you can do. One, let your primary care doctor know, first of all, because they can get that recorded and they can refer you to resources if needed. Certainly monitor your symptoms. If you have more severe symptoms, make sure you contact your primary care provider again. Your local health department has staff that are available to help guide you through what you should be doing if you do have a positive test. So if you're forgetting what isolation means and what quarantine means and what you should do, give your local health department a call in addition, and they can just help walk you through that situation.
Great. Thanks, Doug. Next question is from Lee Pulaski with the Shawano Leader. Lee, your question?
Yes, I had asked, and you guys mentioned how the system is going to be overwhelmed in the Fox Valley region, but we also have a ThedaCare facility up here in Shawano. So wanted to kind of get some input on how the local medical center will be impacted as a result. Will there be COVID cases that have to transfer to the Fox Valley hospitals or other hospitals as a result because of our size?
So I can take that one. Actually, that was the example that I gave of having 10 boarded patients in a smaller ED. Shawano is seeing a significant increase, and we tend to see the increases there before we see them in the Valley. They're always a few days ahead of us. The challenge is there are no beds available to transfer those patients to. So Shawano is actually getting really creative, and as of today, they're actually doing a new triage process in the ED, and patients who are lower acuity will be triaged, but they may be sent to other locations for services, urgent care, primary care settings, and only the sickest will be seen in our emergency department. But that is the struggle in Shawano for beds. We have so many beds, and we are backing up into the emergency department. But because we are part of a larger health system, there were several times last week that the director of nursing at NINA was on the phone with the director of nursing for Shawano trying to figure out how we could move some patients. But it is a challenge because everyone is full. But Shawano is actually, like I said, implementing some new things as of today that will hopefully alleviate some of that volume in the emergency department and get people in the right place of care that Dr. Nichols was talking about earlier.
Thank you, Lynn, for that answer. Next question is from Rob with WTAQ. Rob, your question?
Yeah, thanks for doing this. My question is, how many of the patients that are currently in hospitals in the Fox Valley were admitted to the hospital with COVID-19, and how many were admitted for other reasons but wound up testing positive at the hospital? I guess I'm asking, is there an amount of spread that is occurring within the hospitals themselves, and can that be quantified?
I can take that. So the vast majority of the patients that we have in the hospital right now that have tested positive for COVID-19 are either in the hospital because of that COVID-19 infection, or it's significantly impacted the course of their illness. We do sometimes get patients who are in the hospital for other reasons and incidentally are tested and found to have COVID. But even in those patients, the impact of those patients on our healthcare facility is significant. Anybody walking into the room has to wear specialized equipment and personal protective equipment, which takes usually several minutes to put on and take off and disinfect their hands after each time coming into and out of the room in order to prevent that spread inside the hospital. We've seen very little spread inside hospitals. Most of the cases when we've done tracing have come back as originating from outside the hospital. I would say that the hospital is probably the safest place that you can be in terms of preventing spread from COVID because of all the precautions that we have to take inside the facility as compared to what's taking place outside the hospital.
Can I just add one thing? I just want to remind people that someone can get admitted to the hospital, test negative initially, but still be in that window period of the test. So they can test positive within the facility. But transmission within the facility is is something that's very, very, very low. And most of the transmission that's occurring is within the community. We are seeing a little bit decreased stress on the ICU. We'll cross our fingers and see based on this variant that we are dealing with. But again, we're seeing a lot of community transmission of the virus.
Yeah, this is Doug from Public Health. I would just add to that it's pretty safe to say that there are tens of thousands of people that are currently infected right now in the Fox Valley. You should really anticipate that any public place you go to is a place that COVID is present and may be transmitted. And so just from the sheer numbers of cases that we're seeing, there's going to be asymptomatic people in many locations, and including being admitted to the hospital.
Thank you all for those answers. And Jonathan from WHBY, it seemed like that was your question, very similar to that. So to avoid being repetitive, we're going to ask you to take that answer as well. If there's something else though you need, please follow up with us. Next question, Jessica Thiel from Insight on Business. Jessica, your question's about testing. So Doug, probably one for you.
He did. Yeah, Doug answered it pretty well. But my question was about testing, especially for people with mild symptoms, and what kind of your messaging you're trying to share. Is testing still needed for those with mild symptoms, or should they just assume they have COVID and isolate appropriately?
Yep, great question. If you have a mild symptom and you can stay home, please do. Getting an at-home test kit's a great way. It'll save you time. You won't have to wait at a test site. That being said, it is still good to know if you've actually tested positive or not. In the course of becoming vaccinated, or what your immunity status is, having knowledge that you've had a prior infection may be helpful in the short term, and we'd still recommend that you seek out a test.
Great, thank you. And we have time for a couple more questions here. The next question will be from Monique with Fox 11. Monique, go ahead.
Yes, thank you. What is the average length of stay for the patients who are being hospitalized for COVID?
Frank, that might be one for you, or maybe Dr. Nichols. So I'll let you two maybe both address that.
I'll give you the statistical, kind of mathematical, and then I'll defer to the clinical folks for the specifics. The characteristics of Delta were an 8 to 10 day length of stay. It kept people hospitalized a long time. It was longer than the original. And now this one appears to be in the 3 day range, 3 to 4 day range. So it consumes more resources because you're churning those. You have more patients flowing through, because remember those high numbers, but they stay shorter times. I'll allow others to enlighten you.
I would just say that I would agree with Frank's estimate on the average, but it's a huge range. We've got people who've been in the hospital for months. So it can be a short period of time, or it can be a fairly extensive hospitalization. It all depends on that person's individual characteristics and how severely they've been impacted.
That's a good ad. That is a good ad, because we have, the average really doesn't do justice to the number. The average was 8 to 10 for Delta, 3 to 4 for Omicron, but right, we have folks in with 20 and 30 day stays. Not for Omicron yet, but for Delta, they're still lingering. So right on, doctor.
Okay, and it appears our last question here will be from Griselda with Spectrum News. Go ahead.
Hi, good morning. I just had a quick question on selective surgeries. I know some parts, some hospital systems have kind of scaled back or rescheduled. How does that kind of look like in our area here in the Fox Valley? What are you guys what are those conversations looking like as far as selective elective surgeries?
So I can take that. That's how I started my morning at 6:30, talking about that topic for today and tomorrow's volume. So we look at our inpatient elective cases every day, and we make adjustments based on what our census and our staffing and all of those things are. And so we've had to defer and reschedule several cases over the last few months with Delta. And so we are gearing up that we will be doing, that will continue, and we may even see more cases being rescheduled for a later date with this new volume coming in. As far as outpatient elective, that would be when the system, if what Frank's model is showing and we completely get overwhelmed, that's when we start shutting down outpatient cases and some of our other outpatient service lines to redeploy that staff. So over the last few months, it's been a balance of every day managing, and there are patients that have been, maybe waiting for surgery for quite some time that have had to have their cases rescheduled, which is very difficult for the patient and their family, but it occurs on a day-to-day basis. And I'll let the other health systems add in.
I just want to add something rather than just addressing that. One of the things that, again, I'm a clinician, I'm an ID doc, so pushing for vaccination and boosting is something that can help us try to decrease the backlog of patients that can occur. So again, from my point, my thing is to please get vaccinated, get out there, and if you're vaccinated, get boosted, as this will keep people from having progressive disease requiring hospitalization, hence allowing the hospital to deal with those patients who need other care.
Yeah, I would just say that one of the things I hear sometimes is people commonly call them elective procedures. But for the people getting these surgeries, they're really not elective. These are cancer surgeries, they're heart surgeries, they're joint replacement surgeries for people in constant pain. And so they're really not elective. And so just like Lynn mentioned this morning, every day for the past 2 years, we've been moving puzzle pieces around, trying to figure out how we can get every last procedure done, every last patient to get the care they need. It's stressful. And the nurses who are on these calls have been volunteering for 2 years, like, oh, I'll work a double shift. I'll come in on my day off so that patient doesn't have to get their procedure canceled. It's been incredible dedication over the last 2 years. It's been allowed us to get to this point of being able to continue to meet everyone's needs. But we're kind of at the point where it's at the breaking point. So we really need the community to help rally around the healthcare teams and try to reduce some of the strain here by taking some of the precautions that we've talked about, that Dr. Temple's talked about with vaccination.
Thank you all. That was a very well-rounded answer from all of our systems here. Okay, one last question. I know the last one was supposed to be the last one, but we have one more that we are trying to address here. Tom Nelson's question, probably one for Dr. Temple. So Tom, if you would like to ask your question, and then we'll wrap up.
Right, thank you so much. For the people who are late but realizing that vaccination, of course, works, but now have to wait 6 months for the booster to get adequate protection for the most recent variant, to what extent is that a problem? So it's not the issue of getting people to vaccinate, but it's because you have that 6-month lag. That's my quick first question. And then the second comment question to the group, and I appreciate the regular calls to action. But in the last 2 months, I've gone to at least 4 COVID funerals, and they're 40-somethings, they're early 50-somethings, and oftentimes members of the immediate family are not masking. And I think the challenges that we have in getting people to take these simple precautions, I think that is very illustrative of really the challenge that we have, if not the complete obstacle. I guess from a medical perspective, what do you think about that? If we can do anything more along those lines to deal with that?
Thank you very much for your points. Let me first address the last point regarding masking. Masking, again, it's important. As we say, it's something that will help decrease transmission and likelihood of someone else giving you or you getting the disease. And it's unfortunate that even after death, we're still seeing people not masking. But again, we'll just try to push, get vaccine to get masked. The first question you asked regarding vaccination is rather everyone that's not vaccinated should get vaccinated, because that still does provide protection. So the further out the speculation, the further out you go, the lower your protection of the immunity. So hence the need for the booster. So it's not waiting for the booster will give you protection, but getting vaccinated does provide you some level of protection and decreases the probability of you ending up in the hospital and decreases the likelihood of you ending up needing, basically dying.
Okay, I think that is going to be it for us today. Thank you all so much for taking part, for joining us today. Thank you to all the speakers for taking time out of your very busy day to answer some important questions and give us an update. Media contacts, if you have any other questions or follow-up information that's needed, please feel free to reach out to me, to Chrissy from Advocate Aurora, or Kathleen with Ascension. Our contact information is at the bottom of the media alert. Again, thank you all very much for being with us. Have a good day.